Pillar 2 offers funding for collaborative projects with the goal to tackle the important societal, ecological, and economic challenges Europe is facing, and also to boost its innovation capacity and competitiveness. It contains 6 clusters, and in the next 65 minutes, you will, each cluster will be presented by the responsible NCP. I will present clusters 1 and 3 because I'm responsible for both of them. And then you will hear about cluster 2, 4, 5, and 6. But before I start with the health cluster, let me briefly introduce the main features common to all clusters, starting with the budget. Horizon Europe has the biggest ever research and innovation budget with 95.5 billion euros. And Pillar 2 has more than half of this total budget. You see in the graph on the left, the split between the 3 elements composing Pillar 2. 50% of the 53.5 billion euros will go to the public-private or public-public partnerships. 10% are devoted to missions and 40% for project-based research. I will now explain what these 3 elements are about. We heard yesterday from Massimiliano Esposito that missions are the main novelty in Horizon Europe and that they will operate as a portfolio of actions to spark innovation across sectors and disciplines. 5 missions have been defined so far, and I will present in a few minutes the cancer mission. You will hear more about the 4 others in the related clusters. And partnerships. In Horizon 2020, there were more than 100 different partnerships with multiple structures and rationales. Therefore, a new approach was needed to streamline the funding landscape and to better align the objective of the partnerships with the political priorities of the EU. And you are now familiar with the 3 forms of implementation, which are co-programmed, co-funded, and institutionalized. Interested in participating? But who gets funding? It's in Pillar 2 and Horizon Europe, a broad range of actors can participate, from the academic sector, universities of applied sciences, industry, startups, SMEs, to big industries, also NGOs and others, such as patient organizations, municipalities, or law enforcement agencies. And Pillar 2 is for collaborative projects. So you will need a consortium with a minimum of 3 partners from 3 different member states or associated countries. And new in Horizon Europe is that 1 partner has to come from a member state. And if you are looking for partners or looking to join a consortium, Euresearch will be happy to help you. Additionally, there is a service offered by the Enterprise Europe Network, which is operated in Switzerland by Wyss, and they are covering more than 60 countries with 3,000 local experts. So they really offer excellent service if you want to complete your consortium, if you want to join one. They also organize matchmaking events, offering a good opportunity for networking. So now you have the tools in hand. Let's dive into the clusters, and I will present now the health cluster, its mission, partnerships, and the content of the work program. Cluster 1. Like the other clusters, the health cluster will contribute to the Sustainable Development Goals 3, obviously, good health and well-being, but also SDG 10, reduced inequalities. It will also contribute to different strategy, like the pharmaceutical strategy and the chemical strategies, Europe's Beating Cancer Plan, the digital health space, or part of the Green Deal, the Farm to Fork strategy. In health, there is one mission, the mission on cancer, with the target by 2030 to save more than 3 million lives, living longer and better. And it will tackle both the prevention, diagnosis and treatment, and also the quality of life of patients, their families and carers. And here you will expect less research activities than coordination and support activities in the first activities proposed by the Commission. If you want to know more, the European Commission is planning a communication in March. They have a dedicated website and you can follow them also on Twitter. The health cluster has 7 partnerships, either co-funded or institutionalized. At the end of this year, the Innovative Health Initiative will be launched. It is the follow-up of the Innovative Medicines Initiative joint undertaking. And in addition of the pharmaceutical industry, the medtech, biotech, vaccines and imaging industries will be part of this joint undertaking also. The EU-Africa Global Health Partnership is the follow-up of the EDCTP 3. And we expect this year also the partnership on assessment of risk of chemicals. For next year, the Transforming Health and Care Systems Partnership is planned. Here, the Active and Assisted Living Partnership will be integrated and several ERANETs as well. In 2023, the Personalized Medicines Partnership should be launched, and in 2024, the One Health Antimicrobial Resistance and the Rare Diseases Partnership. These partnerships will issue calls for proposals where external researchers can participate. But it will be in a time frame not before 2022. The health cluster also has a work program and issuing calls for proposals. And a work program is a collection of topics for 2 years, and it is structured in destinations. Each destination has calls, and calls have topics. And I will now give an overview of the 6 destinations contained in the health work program. Destination 1, staying healthy in a rapidly changing society, is about understanding the transition from health to disease and trying to prevent this by motivating citizens to adopt healthier lifestyles and behaviors. And topics here are on understanding mental health, preventing obesity, and fostering personalized prevention. Destination 2, living and working in a health-promoting environment, is about understanding the effect of environment on health. Topics will tackle the effect of electromagnetic fields or indoor air quality. In Destination 3, tackling diseases and reducing disease burden, the aim is to understand diseases, and disease in a broad sense. It includes infectious diseases, rare and non-communicable diseases. And the aim is to develop prevention measures to improve diagnostics, vaccines, therapies, and better manage epidemic outbreaks. Destination 4, ensuring access to innovative, sustainable, and high-quality healthcare, arose after the COVID-19 crisis showed the needs for more resilient healthcare systems. And here it is about people-centered solutions to improve the quality of health and care, to take better informed healthcare decisions. Destination 5, unlocking the full potential of new tools, technologies, and digital solutions for a healthy society, is the digital health topic. Even if digital health is present in each destination, this is really the focus here. And the aim is to make best use of the vast amount of data and to develop tools, technologies, and digital solutions for treatments, for medicines, medical devices, and to improve health outcomes. The 6th destination, maintaining an innovative, sustainable, and globally competitive health industry, has an industry focus, as the title says. It's about strengthening EU's economic position by delivering safe and clinically validated tools, technologies and services, for instance, new payment models for cost-effective health innovations. The first calls are expected to open end of April 2021, and we expect the first deadlines on 21 September 2021. This is still draft, is subject to change, but these are the deadlines we have. Sascha Hugentobler and myself will be happy to answer your question, help you with your project ideas you may have. Don't hesitate to put your questions now or later. Thank you. And now let's jump to cluster 3, civil security for society. The security cluster will also contribute to different sustainable development goals, which are SDG 9, industry, innovation and infrastructure, SDG 11, sustainable cities and communities, SDG 16, peace, justice and strong institutions. It will also contribute to the Security Union strategy, to the new Pact on Migration and Asylum, to the Cybersecurity Act, and to the disaster risk reduction policies. The cluster 3 has a work program with 6 destinations also, which I will present you now in more detail. Destination 1, better protect the EU and its citizens against crime and terrorism, has the aim to tackle more effectively crime and terrorism while respecting fundamental rights. Destination 2 has the aim to improve travel of legitimate passengers and shipments into the EU while preventing illicit trades, trafficking, piracy, and other criminal acts. Destination 3 has the aim to enhance resilience and autonomy of physical and digital infrastructures. Destination 4 will contribute to secure services and robust digital infrastructures capable to resist and counter cyber attacks and hybrid threats. And Destination 5 has the aim to reduce losses from natural, man-made, accidental disasters. And Destination 6 will address security threats thanks to better cross-cutting knowledge across different areas of security and different disciplines, including social sciences and humanities. And this keyword is the ideal transition then to the next cluster, cluster 2. In security, we expect the first call also to open in April 2021 and the first deadlines on 26 August of this year. And here too, I will be happy to answer your questions now or later and advise you for your project ideas. With this, I finish my presentation and thank you for your attention.